Pop Health Podcast is a public service of 24-hour home care.
Hello, everyone, and welcome to another episode of Pop Health Podcast. This is Gavin Ward, host of Pop Health Podcast. In today's episode, you'll notice a little bit of a different background. Well, I'm actually recording this from my wife's office at our home. She's a third grade teacher, so that's why you see a little bit of a different background as we're all virtual in today's world. We had a very special guest today, leading social worker Matt Chappell, who's the manager of care coordination and a licensed clinical social work working for Stanford Healthcare. In today's episode, Matt shares about his 25 years of social work in the Bay Area, including serving the HIV population and doing a lot of mental health work before transitioning into healthcare, where he's worked for both Sutter and Stanford, and he has private practice. We hope you enjoyed today's episode, learning from Matt's journey in healthcare. And of course, you can check out other episodes of Pop Health Podcast by visiting us at pophealthpodcast.com, our YouTube channel, Stitcher, or Apple Music as well. Thanks, everybody. Enjoy the show. Well, Matt, thank you so much for joining us on Pop Health Podcast as we celebrate Social Work Month in March. Before we get into more about social work and your expertise, we like to get to know you a little bit. So let's start with a fun fact about you, maybe something outside of the workplace, maybe a fun fact, a hobby, something like that.
All right. Well, first of all, thank you very much. It's an honor to be asked to do this. And I don't know if it's a fun fact or not, but I was a competitive swimmer for many years. I was a butterfly and breaststroker, and I still love swimming, even though there's no pools that are open up here.
Yeah, man, I was going to ask if you still swim, but unless you have a gigantic pool at your own home.
Yeah.
Not happening. Well, I got
my COVID pounds to prove it.
Well, I thought social workers made a ton of money, and you can have these multi-million-dollar pools.
That'd be nice.
Yeah. So when was the last time you actually went swimming?
It's been a year.
Oh man. So
February last year.
So pre-COVID, where were you swimming?
There's various pools in the area. Stanford, of course, has like world-class pools, even at their gym. But there's a place called Burlingame High School swim pool, which is very good, which is just reopened. And in San Francisco, USF, University of San Francisco.
Yeah. Okay. Nice. Well, let's talk a little bit about your background, Matt. So you grew up in Michigan. Tell us a little bit about that.
Do I have to? Michigan's a beautiful place. I'm glad I grew up there. I much prefer California. I'll be honest about that. But I grew up in Southwest Michigan. I'm from a big family. A lot of nurses in my family, just I don't know what else to say.
Yeah, no worries. So you grew up in Michigan, and tell us about what made you decide as you're growing up to maybe, look at social work as a career, or if it wasn't formally doing social work. I know your family was nurses. Like, what were you thinking growing up about, kind of following that direction?
I absolutely was not thinking about social work growing up. I was thinking about psychology, however. I initially wanted to be a histologist and study tissues and do research, which helps a lot as far as a social worker to be able to work in a hospital and understand a lot of the medical terminology and disease processes and things like that. So I do think I just naturally have that interest. But growing up, if you asked me what a social worker was, I probably wouldn't be able to answer that question. And I was much more on track to study biology.
Okay, so tell us a little bit about that. So you're on track to study biology. Then what happens? Life happens,
and a lot of life happens. And in that is how I ended up doing social work. I ended up working in the substance abuse arena, in the HIV arena, and long before I became a social worker. And it's just work that presented itself. And I guess the best way to say it is that there's a difference between a occupation and a vocation. And I learned that this is the work that I'm supposed to be doing, rather than the playing with tissues in a lab or something.
Yeah, I mean, just knowing a little bit about your background, I mean, you were doing, some very meaningful work in the 90s when you're out in California. May I ask how you made the move out to California, and if you started that type of work in California, if you actually started out in Michigan?
In Michigan, I worked with autistics. I did behavior plans. There's Michigan deinstitutionalized in the late 70s and early 80s. They deinstitutionalized a lot of developmentally disabled people. There's a high percentage there per capita, one of the highest in the country. And so there's a lot of people that were in group homes or sheltered work environments or schools and things that. So there was lots of my friends worked in that arena. They taught autistic kids, and they were. I had friends that were social workers and teachers and stuff, and so I ended up being interested in that and writing behavior plans for people, for autistic kids, which was a very interesting job to have. Jobs are not, at that time, there wasn't like a plethora of opportunity.
Yeah. So you started that in Michigan. How did you end up coming out to California?
So I came out to California in the late 80s. And when I came out to California, I moved to San Francisco. And in San Francisco, I quickly got involved in the gay community here and in the HIV community. And I became an activist and an AIDS activist. That's honestly how I ended up doing social work. Someone had seen me working with a drug company. I don't know if I should say the name or not, trying to push their drug through the FDA, and which we ended up successfully doing, but thought I should, hey, you should apply to work at the nation's first HIV mental health and substance abuse program. You'd be really good at it. And I'm like, I don't think so. But then I relented. And that's how I really started my track into social work. So I started, it was a milieu therapy and for the nation's first program, HIV, mental health, and substance abuse. And we saw a lot of people go through that program and get helped out. And the training for me, the clinical training, was very good. So I just then moved to work for a program called AIDS Health Project at UCSF. Kind of just expanding on that work, working with high-risk populations that were HIV positive. And then that ultimately morphed into working with complex mental health patients. And then I went to school.
Yeah, that is crazy. I mean, usually school comes first. So you were literally making history. I mean, I remember growing up in the 90s and, serving the gay population, the HIV population, wasn't as, there weren't as many opportunities, nor was it as supported. So you were there kind of, I don't know if grassroots is the right term, but you were there, the beginning is probably not the right term either, but that's evolved so much over the years. What's different today? Like from your lens, if you joined that type of work today versus 30 years ago, what would be different?
Oh, a lot is different. Like I was just talking to a colleague of mine before this and then explaining how most of my friends are dead from that era.
Wow.
And that you don't, and that I didn't really think that to be around perhaps this long myself. And so back then it was a crisis, very parallel to COVID, actually. If in some ways that you had people that were dying in droves, you had a community wanting some semblance of anything you could attach hope to, and now you have effective medications that can sustain somebody's life a lot longer, that can help stave off getting some of the opportunistic infections that you get with HIV. You have systems that were were ideas back then that you've seen grow into big service provider lines, and it's quite different than it was. It's still a highly prevalent disease. I mean, one way to think about HIV is when you get HIV, you get a whole disease of society with it, and that's one of the things that's kind of similar with COVID. Like with COVID, like you can get a disease of society with COVID as well. Like I've certainly heard people tell me that they've been blamed for COVID if they're Asian, for example.
Yeah.
That's a horrible thing. But that is very much similar to how HIV was.
Wow, I've known you for many years, and I mean, you probably have some amazing stories. I mean, even this is pretty neat to hear about your background back in the 90s doing this work. So you're doing this work, this meaningful work, impactful work, and then you decide to go to school. What was the trigger that said, you know what, I should probably go to school for this?
Well, I was doing it, and people were getting paid a hell of a lot more than I was for the same work, and they all went to school. So I was just fortunate to have places like UCSF that hired me without a degree, and had that kind of confidence in my abilities back then, and really supported me going back to school and things like that. I, like many children of the 80s, I didn't have a whole lot of credits when I decided to go back to school in my 30s, and it was a process that really took a lot of dedication and work. Basically started from scratch.
Wow, man. So you do that in your 30s. You get your you eventually got your MSW at San Francisco State, if I recall correctly, just by connecting with you prior and checking out your background. And you got it with a 4.0. So, you're clearly motivated and driven. The 4.0, I mean, I felt like I was a motivated college student, but I didn't get a 4.0. Like, do you mind me asking, is it just a self-motivation, or was there any other outside influences that were really pushing you to get that MSW at a 4.0?
I think one thing about social work is that it's one of those professions that is two things. One, social work means a lot of things. You can call a lot of things social work. You can do anything from community organizing to psychotherapy to being an activist to working in a hospital to working with CPS or APS. It can be a lot of things. And what I'm getting at is that the knowledge is cumulative. So I always want to continue to hopefully know what I don't know and learn what I need to keep expanding on and expanding on and expanding on. So that it didn't really. I love what I do, so it didn't really require a lot of extra motivation.
Yeah.
I mean, I did go to school. I did work all the time through school and everything, and maybe that's something about growing up in Michigan. You got a work ethic where you'll do stuff like that, but it really is a kind of profession where it matters to keep it just learning and building on your experience and your knowledge base. And it goes in many, many directions. It's a good profession for people that have too many interests.
Nice. So you finished school, and then you ended up, hopefully with a little bit of a bigger paycheck, now that you had that degree, and you end up working for Sutter for many years. Tell us about that transition to, go work for a big health system.
So to be honest about it, I had a choice to make, and it was either to try to figure out a way to go to the Jung Institute and continue on the track of being a therapist, or get a job where you have insurance. So I ended up, it was not a hard jump for me to having medical knowledge already, especially from the HIV pandemic, to go into work and a hospital setting. So I did both home health. I started out in home health with them, went into hospice for them as well. They put me in hospice and worked there for a while. And then I ended up doing med-surg social work at their main hospital in San Francisco.
Okay, awesome. So you're at Sutter for many years. You have insurance, which hopefully gave you some peace of mind. And you're there for many years. I mean, I don't have the exact number on my notes here, but I know it was well over 10 years.
14. I was there for 14 years.
Okay, for 14 years up in the city, as they call it up north. And then eventually you also decided to, do some private practice work. Do you mind touching on that?
I've always had that passion and ability, and it's an area where I have fairly good skill, and I just love doing private practice, but I haven't made it like my 100% going to hang your all of your career on this. I think that it might sound a little hokey to say this, or corny, but I'm actually working where I'm supposed to be working. Like if that was really the trajectory, I'd probably be immersed in that trajectory a lot more than I am. But I do keep a private practice, and it is absolutely fascinating. It's wonderful.
Awesome. So you have your full-time leadership role there at Stanford. You have private practice, and you're serving with groups like the American Case Management Association on their national board. Are you going to have time for swimming when COVID ends?
Yeah.
All right.
You got to take care of yourself, especially through time. I think that people really, that's one of the things I think that hopefully the country really focuses on during this time, that maybe if there's a quote unquote silver lining from COVID is that self-care matters a lot. Resiliency, you'll hear a lot. I wonder how many conferences there will be about resiliency in this next year. It's really, really important. So I think to me, if you want to sit back and really look at it, it's all patient care. So if I'm like in a management position, it's still the main thing is like, how do patients get the very best care they can get? If I'm volunteering with the ACMA and doing work with the boards and things like that and helping putting on conferences, it's all about patient care. Like, how do you raise the level of care for patients? That's really where the rubber hits the road. So the way I see it, everything, like every time you write a note, like sometimes you hear people complain about charting, like, well, that's patient care, right? Like it's just part of patient care. So all of this cumulatively is all patient care. It has nothing to do with me at all.
So let's talk about patient care then. So, being a social worker, I'm not a social worker. My wife's a teacher in a low income area, and she kind of does some social work, you probably can imagine.
Yeah.
To be upfront, I'd probably break down, if I was a social worker. There's a ton of stresses. You can't solve every single challenge. So what are some of the challenges that people may not know about? Let's say a lay person. I mean, we're talking to healthcare professionals for the most part, but yeah, maybe what do people not know about the challenges you guys face or your team faces?
Well, first of all, I think for me, when I see a patient, it truly is an honor. And I think that for a lot of people in our profession, in the caring profession, that's how they interact with patients, and that it's an honor. I get to do this. Like I get to go see a patient. I get to go talk to somebody. Like I said, it really has very little to do with me at all. But I think one of the things that people may not know about is that social work in a hospital setting is very multidisciplinary. We're part of a multidisciplinary team, and we're going to go and see patients and really address as much of the social determinants of health or psychosocial issues that you can address with a patient in this little blip of time that you have them in a hospital setting. So it could be a lot of things. It could be anything from coping with a new diagnosis, for example, to fundamentally learning about, oh, hey, I'm going to help this person get their disability. That's going to that's going to help them a lot. Or I'm going to explain this hospice benefit to somebody, or I'm going to do a substance abuse eval with this person, or this person's suicidal. Let's help that person, and hopefully they don't commit suicide. So, or this happens to me all the time. Like grandma breaks her hip or something, they just wrap me around their finger in like 2 seconds, and I get to go in and talk to somebody about like, how do you set up for success at home? Like, can you get enough help to help you in order to recover properly, or what about the long-term planning? So you get to do all sorts of things with patients. It's broad. I'll admit there's differences geographically in different hospital systems where case managers and social workers do different things. So, but for me, like that's the gem. The gem is the way I get to interact with somebody. It's always an honor.
Okay, so doing a lot, like you said, if you have too many interests, social work is for you, and you just named a lot of different things that you can.
Every case is like a new vignette. Is someone comes into the hospital, their whole life comes into the hospital at that, and you're with them at that point in their life, right? So whatever could be going on could be all sorts of different things going on or not going on.
So
not everyone needs social work.
Yeah, and let's talk about that really quickly. So you said not everybody needs social work. So in a hospital setting, like maybe in simple terms, like who gets assigned a social worker? Like how do you define that?
Definitely anyone that has some sort of crisis going on is going to get a social worker. So it could be a psychiatric crisis. It could be a medical crisis where, for example, falls are a big example of that. Where, if there's a point in time in life where if you're at a certain age, it only takes one fall and then it's a whole trajectory downward. You've seen it a million times. So it could be so certainly crisis or urgent situations will get attention. Homeless in California, homeless patients need to be seen by social work. It's a law.
Yeah.
So, but somebody who, like, let's say somebody has a surgery that's an elective surgery and they have good support and, they already did their disability work if they're employed, and they already have things set up for themselves, then they may not need to talk to a social worker.
Yeah, no, that's a good point. I've been in the industry for about 20 years and, it's not always clear who should have a social worker or who should not, but I think you defined it with the crises statement. That was a pretty good explanation and one of the better explanations that I've heard. So what about a success? Maybe let's talk about your 20 years in a hospital setting. Is there a story or something you like? Let's say you're talking to, in the future kids about your career, young kids, you're retired, you're teaching about your career. What's a success story you can share? Do you remember, without naming names, anything you can share with our audience?
Well, yeah, fortunately, there's success stories every day. So a good example would be, I have a social worker who works overnights and had a patient come in for having difficulty breathing, but it turns out really what was going on is that person was in a domestic violence situation. And he got to do a lot of counseling and help that person address their domestic violence situation at 2:00 in the morning.
Wow.
So that's a really good example of a success story that really what was going on was that person needed help around an issue and it was just manifesting itself in a certain way. Or we had another patient, I'm just going with what I heard today. So we had a patient yesterday that was a kid, and a kid fell off his bike and hit his head, and he's like 3. And so the parents had ideas about CT scans and didn't want to do that. And so they involved a social worker to talk to the parents, and they were able to talk with the parents on the parents' level of understanding of things. so that they understood that it's not a bad thing that they want to do a scan of this kid's head, because a lot can happen to a kid. And while that might be common sense for a lot of people, for others, it may not be culturally relevant. So that is another example just from yesterday. And I personally, it's really hard to sum up, over 20 years of direct experience working in hospitals. I've seen so many patients go through so many different things, anywhere from being able to, I guess talking to a patient about death is a really good example, because if you are not uncomfortable talking about it with somebody, like someone might know, like I've had patients tell me, like they know that they're terminally ill.
Yeah.
And they know that some people might be tiptoeing around talking about that discussion. But if I'm able to listen to them and meet with them on a level where they're at and hear them out and hear about their ideas and fears if they have them, or how they want that to go, and be able to be witness to that. And maybe I know some services that might help guide them through that point in time in their life. That's a really valuable thing to a lot of patients. I've certainly had patients be very thankful that they were able simply to talk to a social worker about even substance use, for example.
Yeah.
Like somebody that can hear them out, hear what they're going through, what their experience is. And they may not make a change at that exact moment. Maybe 3-5 years down the road, that discussion influences it. But I've certainly had people come back and like tell me, and I honestly don't even remember talking to them sometimes, that like, oh yeah, you talked to me and you told me X, Y, and Z, and I heard that. I didn't act on it right then, but a couple of years later, like, oh, I want to come back and volunteer at your hospital. So you just never know. You never know that. Like, we're all role models, I suppose, on some level, but you're just being able to listen to somebody and meet with them, and hear who they are and where they're at with this situation in their life, and this blip of time in a hospital, can make a huge difference in somebody's care, and perhaps maybe in their life. I've certainly seen that happen.
Some good examples there, Matt. As a reminder to the audience, one of the reasons we're having Matt on in March is for Social Work Month. And Matt's talked a little bit about his background, and they're social workers through all different, industries. I have a lot of friends, Matt, I'm sure you know, social workers who work with foster kids, for example, and they're doing great work. Matt talked about his history with behavioral health and the HIV community, and we have hospital social workers. So I'm sure all of us listening know social workers or are a social worker. So Matt, what can people do in March to celebrate social workers besides, I guess, thank you, right?
Thank you is good. Thank you is enough for a lot of people. Just thinking some sort of affirmation, some sort of acknowledgement that we appreciate your work, I think for most people is enough.
Yeah, no, well said. So again, folks, in this month of social work appreciation, if you know social workers in your life, whether they're formal or informal, I encourage you to recognize them. We're recognizing Matt today and his leadership and his background. So Matt, appreciate you being on the show today. And then want to give you a chance to maybe to plug some of the groups you're involved with. We talked about the American Case Management Association. So Matt, why should people, or what's good about the ACMA? Why should people consider joining?
So the American Case Management Association is primarily focused on what's called case management. That's really a nursing service, for fear of a better word, where the nurse case managers can become accredited, and it just raises the level of the ability of someone to coordinate everything that goes through with discharging a patient from a hospital, from the minute that they walk through the door to doing what's called interqual, or working with their insurance authorization, to assessing what their needs are, to helping set that up, to making sure that happens in a timely manner and hopefully in a seamless manner as much as possible so that they can get home and succeed. And then when they're at home, perhaps they have someone like your services come out and help them at home, or home health come out and provide nursing or physical therapy or something to go along. And the American Case Management Association is a well-established organization. It has 33 chapters around the country. We in California have a Northern California and Southern California chapter that play well together and work well together, and we have a lot of fun but really what we want to do is make sure that we get education out to people in the case management arena, and that can help raise the level of care that we provide.
Awesome, Matt. Well, thank you very much. One of the reasons I reached out to Matt, actually, I saw him at an ACMA virtual event just, I don't know, a week or two, maybe just a week ago, 2 weeks ago.
Late.
Yeah. No worries, though. It was a SoCal chapter and you were supporting too. So that was a cool thing for you to do. And Matt, you're the acting ACMA Northern California chapter president.
I'm the outgoing.
Outgoing. Yeah, outgoing.
Kathy Nicker Johnson is the new president. So
okay.
In April, it's been a great experience, and I care enough about the profession to volunteer my time. Absolutely.
Awesome. And folks, feel free to check out more about ACMA. Do you know the website, Matt? I don't have it memorized. Okay, no problem. Google American Case Management Association.
I can probably Google it really fast here. Sorry.
I didn't mean to tell you to do that. I meant the audience. All right.
So, definitely. ACMA. We really appreciate the work that you do and the services that you provide to patients. It's invaluable. Before this, we were talking about, that hands-on care is perhaps the most important care someone can get.
Yeah, no, absolutely, Matt. So, folks, I know Matt's on LinkedIn, so feel free to, I hope it's okay. If folks want to keep tabs on what you're up to check you out on LinkedIn. And of course, feel free to check out American Case Management Association. You can Google, of course, Stanford Healthcare as well to get those sites. Matt, really appreciate you joining the show and honoring social workers this month just by your presence and learning from you. And best wishes to you. Look forward to seeing you at other ACMA events. And and hope you get swimming in soon.
Oh my God, so do I. So is my waist. My waistline. Thank you very much. It's an honor to talk to you.
All right. Well, thank you very much. And folks, again, take care and honor those social workers in the month of March.
Thanks everyone for tuning in to another episode of Pop Health Podcast. We hope you've enjoyed today's episode, and if you have and want to check out other episodes, visit us at pophealthpodcast.com, iTunes or Apple Music, Spotify, Stitcher, and now YouTube as well. Take care.